So in the beginning, let me tell you all that I just had a very bad COVID and my lungs are a little weak. So if I talk for a long time, I start coughing. So please excuse me for that. So Jayesh is sitting next to me. So we'll shift over all the time. Uh, Jayesh will give you a small introduction how this master score came into existence and what was the idea behind master score, some historical background, and then actual what master score is. We have made this PowerPoint. So we'll start now our presentation.
Good afternoon, everyone. Yeah. So we've been working with Dr. Master since the last, I think, more than 20 years, and we have been seeing his way of practicing, his method of looking at totality of symptoms, his method of repertorization and everything. So we working with him. One day also we told him, sir, why don't you make a module of our own so that it becomes a thing for all the homeopaths all over the world to understand the way you look at it, the successes, what you get with your cases and all. So the idea of master score came much years before, but because of his very busy practice and time schedule, it took some time for it to build it up. So Master Score is the ultimate tool to fine-tune your prescribing results using the Radar Opus software. It's a tool. It's not going to give you the final result, okay, prescribe this remedy, but it will give you an understanding about a few remedies which can help you in your case in a better manner. So it will make you reach towards the simillimum in a much more better manner. You can prescribe the remedy more confidently after you utilize this particular master score. So it is particularly useful for cases that need a deeper study because it gives a meaningful insight at a single glance, saving time and preventing potentially significant omissions of candidate remedies. So when you're using this module in Radar Opus, and once you analyze your case with this master score, at a single glance in one single repertory sheet, you get a particular scoring of the drug. Higher the score of the drug, the better that drug seems to be indicated in that case. So once looking at the repertory sheet using this particular module, you save time and you prevent potentially significant omissions of remedies. Sometimes when, in your normal repertorization, your drug may be a little bit more further down, say 9th or 10th remedy or something in your repertory sheet, and you may not consider that remedy. But when you're utilizing this particular module, that 10th remedy can also come up in the first 3 or 4 results after using the module, so that you can study that remedy in the Materia Medica, ask specific questions to your Materia Medica, and you can still prescribe that particular remedy. So it prevents the omission of candidate remedies to a great extent. So in master score, so each remedy is evaluated according to the author's reference. That is, references from classical and reliable authors are given more importance. So now, as we all know that new and new authors, new and new drugs are being added to the repertory every day. But are all those authors, are all those remedies reliable? Difficult to understand. But what Dr. Master has worked in this particular module is that the classical authors like Kent, Boger, Boningussen, Hahnemann, and many of the classical authors are given higher importance and higher preferences. So when you are repertorizing through this module, the additions from these authors will are given more marks than the authors which are new, whose reliability can be questioned. Okay, so The remedy is evaluated according to the author's reference. The more a remedy is referenced, the more point it earns. That is, if a remedy is referred by more authors, it is given more importance. Like in any rubric or any symptom in the repertory, if a one particular remedy in that particular rubric is referred by more than one author, by 2 or 3 or 4, then that particular drug in that rubric is given much more importance and credibility than other drugs. That means, yes, this drug is confirmed by many of the authors in this particular symptom. That's why it is more important in the whole totality. This again is very important. The method takes into account the intensity of the symptom as in formation of totality of symptoms. Not only symptom coverage is important, but also the intensity with which the symptom is covered by the remedy is important. So it is not only quantitative understanding, it is also a qualitative phenomenon. We have seen from our experience with working with Dr. Master sir is that he always stresses on giving importance to the symptom, how the patient narrates the symptom, whether it is intense by 3 marks or 2 marks or 1 mark or 5 marks, how the patient has narrated. So when you are using this particular module, depending on the intensity of the drug in that particular rubric and depending upon the intensity of that symptom in the patient, that much amount of importance is given to the remedy. Okay, so intensity is important when you are utilizing master score. Now the calculation, after you have put all these things in your repertory, the calculation will show the remedies sorted according to the value achieved by each remedy. So you get a numerical score. After you repertorize and use this particular module, you get a numerical score. Higher the score, better is the remedy indicated. So you get a group of drugs with high score. You can decide that, okay, I need to see the remedies only up to this score or this score, and then you can go to your materia medica and start differentiating between those remedies. Now, the minimum amount of symptom that you need to work with this module is at least 5. You need at least 5 symptoms for it to work in the radar opus repertory. Now, let us see how we utilize master score in our cases. So, master score, when routinely used in practice, will be helpful to understand repertorization more deeply, as we don't have to look at the repertory result quantitatively only, but also qualitatively. As I told you in the previous slide, that it not only does take into consideration the symptom coverage, but also the intensity, also the quality of the symptoms. So you are taking into consideration in your cases both at the same time, the quantity, that is the symptom coverage, at the same time the quality of the symptom. Dr. Farokh Master says, master score has a potential to bring a new level of homeopathic practice and elevate the status of homeopathy around the world. So, one of the important parts of master score is that it filters out the remedies which haven't undergone appropriate pathogenesis. In other words, cloned remedies. That means remedies that have never experienced an adequate investigation. As I told you, more importance, more relevance is given to the additions given by classical authors than by newer authors. Yes, there are newer authors which are important, which give us many a times good remedies also, but the problem is their authenticity. So if the remedy is not been adequately investigated, then that remedy score in the master score is quite less than the remedy which has been very well investigated. So by this method of filtering remedies, we can be surer and more specific in prescribing the indicated remedy. So with master score, Because you can clarify the remedy selection and drill down into the correct remedy by asking questions of materia medica. So when you're looking to see what questions to ask or what remedy you want to select, you can quickly look at the materia medica, which of course is the final stage in making a prescription. So after you have done the analysis through the master score and you get a few remedies in your repertory, you can go back to the materia medica, ask specific questions regarding those remedies to your patient and confirm your remedy in a much more better manner using this method of or this module of repertorization. So master score is an expert system in the sense that it evaluates the rubrics according to their importance. Like when we were students and learning different methods of repertorization or different methods of totality formation, we talked about that. Yes, in when we utilize Kantian approach, we utilize mind as more important than physical generals and particulars, and we used to give more importance to or more marks to the mental state than to the physical generals and then to the particulars. In the same way, master score is an expert system in the sense that it evaluates the rubrics according to their importance. It brings up different remedies, so you can really choose what symptom are the most important for you, as well as the remedy which has marked these symptoms. This unique calculation system only exists in Radar Opus. So as I told you, you get a final score that this is the score of the remedy depending upon the algorithm what has gone into the preparation of this particular module. So depending upon your totality, how you have put in the symptom, how you have given importance to what symptom, you will get a unique score, a calculation which will help you to finally decide, yes, this is the remedy which I want to give to my patient. Dr. Master says that I use it successfully also when teaching because it shows me the remedy I prescribed amongst the first results. It's easy to spot because it has marked symptom of the case, the characteristic symptoms and so on. So main features of Radar of Master Score. It's an advanced expert system based on groundbreaking research in homeopathic prescribing. It is not built in a few days. It was not, the idea came up slowly in Sir's mind. He's worked very hard with all the symptoms around. His experience has gone through it. So it is really an advanced expert system. And we have spent hours on it, talking about which author he feels is more important in the materia medica or in the repertory, which symptoms are more important, which symptoms are not important. He's gone through majority of the source books when he's been grading the drugs, when he's been grading the authors. So it's really an expert system which has gone on groundbreaking research. So with this, you can ask materia medica questions to your patient using your analysis of the master score to confirm your remedies. And master score uses the latest synthesis repertory, which is constantly updated. It is very simple. It has a very intuitive graphical user interface. You don't have to press a lot of buttons around. You don't have to go through a lot of things. Just on the click of one button, you get the whole analysis of master score. It is available in all 9 synthesis languages at the moment. And it is available for Radar Opus 3.3 users and later. And at the same time, just like a normal repertory sheet, you can export the master score analysis to a file. You can print it or you can save the analysis also. Okay, so this is a small understanding, a theoretical thing about master score. Yeah, so Dr. Master would highlight the thing with a case so that you'll understand better how the whole thing is being worked out.
So let me show you a case example. This was the case of a diabetic gangrene. You can see in the picture how badly the fingers are affected. And let us not go too much into the detail of the case because this is not so important. The patient was asked amputation of the fingers, and these were the modalities: bursting pain on touch, hanging the limbs aggravate. It all started after diabetic carbuncle, and a lot of antibiotics was given in the hospital, and regularly they were draining all the pus and the slough. But finally the doctor said that amputation is a must. Patient refused amputation, so patient was referred to me in the hospital. And as usual, we took homeopathic history. So we measured the weight, there was hair loss, there was weight loss also, thirst for sips of water. And then we went into the life situation of the patient, which I don't want to discuss. This was the examination finding, and she was advised to stop all allopathic drugs and be only on homeopathy. We did a lot of investigation regarding her kidney function. As you can see here, the kidneys were very, very weak over here. And diabetes is out of control. 16 is the A1C level. And we took the symptoms for repertorization. Now these are the symptoms without master score. And you will see over here that sickle core arsenic lachesis silicea comes in the full repertory view without using a master score. Now, the best part is that you will see over here the 3 remedies cover 7 rubrics together, and then almost 7 remedies cover 6 rubrics together. So then it becomes very difficult which is correct remedy, which you should prescribe, and it gives you a large group of remedies to differentiate in materia medica, which can be time consuming. I won't say it's impossible, but it is time consuming. But suppose you decide to apply master score to the same rubric, and what you will see over here, can you see master score analysis over here? And now you will see that there is no confusion of many remedies with the same coverage of the rubrics. It just tells you the marks.
Scoring.
So scoring system. So here you will see the scores: 403, 384, 363. And so based on that, sickle core score was highest. So we started with sickle core, and we did follow up for many months together. I don't want to show you the detailed follow up because that will not interest you.
Then the chronic case was.
And then, I think so. Yeah. So with the sickle core, she improved a lot in her pain, discharge, infection, septicemia, and then we took the chronic layer of the patient, selecting these rubrics, a deeper prescription. Again, without master score, you will see sulfur comes first. But I was not very happy with the sulfur because sulfur is not the remedy for this kind of patients. So now we apply master score, and you will see phosphorus comes number 2, which was not there previously. Can you see over here? It comes number 4. When you apply master score, it jumps much forward, and that is why after phosphorus, giving phosphorus to the patient, 30C, we followed the case, and even the diabetes improved, the kidney failure improved under phosphorus, and finally the fingers became totally normal. There was no gangrene. We could prevent the amputation. So master score helps in reaching the minimum with confidence. Let me show you another case also as an example to you. It's a case of thyroiditis. Acute infective thyroiditis. This is also a hospital case. So here also there was an acute infectious thyroiditis in 38 years old male patient. Comes with a severe pain, swelling, inflammation in the neck. We took the history as usual. We did ultrasonography, and now these are the rubrics. Now when we took the rubrics and repertorized without master score, you will see alumina comes first. But I was not very happy with the suggestion of this kind of analysis. So then we applied master score and Hepar sulf came first. And we give Hepar. After giving Hepar, patient started improving. Then again, there was a little aggravation. So we took a new totality. And then this was without master score. The throat pain came in a big way again. And then with master score, you will see over here, belladonna come first, Merck IF comes second. So the patient kept on belladonna, and then in different potencies of belladonna, everything went well. All the reports became normal. Finally, we gave thyroidinum to the patient. That was an intercurrent remedy without repatriation. And now everything is normal. The patient is totally cured about his thyroiditis. So as you can see, working becomes very simple. I have just taken two cases as example to show you how I use master score. While making a master score, I have given a lot of importance to the source of the remedy. Like we have a remedy like Berlin Wall. This remedy Berlin Wall cannot be a standardized source. Do you follow? Whether it is made from brick, cement, debris, and there are so many other drugs whose source is very doubtful. Big question mark. Do you follow? And that is why those remedies with doubtful source has got very poor marking in my master score. The third most important thing is how many people have used that remedy and cured that particular specific pathology. We have a large collection of journals right from the Hahnemannian time till the current scenario of homeopathic links, and we have seen how many cases that particular remedy has cured that particular pathology. If more pathologies were cured with that remedy, then that remedy again gets a higher marks. That even though that remedy is very famous with homeopaths, but it has not been shown and reported cured cases, at least in journal, we have not given very good marks to that particular remedy. Do you follow? So in every aspect we have verified. Sometimes a rubric or a remedy appears in one edition of repertory, in another edition of repertory that remedy disappears. So then we have a pinch of salt with that kind of, remedy. So again the marks goes down. So all those minor things that we have seen was not a part of expert system. In future, we are going to bring multiple editions of master score. So in future, the next part is that I am going to give you suggestions. Please ask these questions to confirm the remedy, but that will be the next part. First, I want the profession to accept this kind of scoring system. Once it is accepted, once it is used for a few years, we'll introduce asking questions or something like artificial intelligence. And then based on your questions and answers, the master score will say, okay, now you asked this question. Now this could be the best remedy for your problem. So this is how I would like to end my presentation regarding master score. And if you are having any doubts or questions, me and Jayesh will be too happy to address the queries.
We had a scoring system from 1 to 10, and the authors which are classical authors, which are very well represented in the Materia Medica and in the repertory, where the confirmation of their symptoms are done. So those authors, those remedies or those additions from those authors, we have grouped it from 1 to 10, where 1 being the least confident and 10 being the highest marks that we have given to that particular author.
Also, Marco, most important thing that we had seen was that homeopathic literature before 1964 is extremely authentic, where people like legendary people like Herring or Nair or Lippi gave their original ideas related to Materia Medica, related to rubric. After 1964, the standard deteriorated, and it has become worse in the last 25 years. The last 25 years, if you examine the literature, it is Xerox of Xerox of Xerox and cut paste from the original literature. So there is no point including that kind of stuff in our master score, because we have already taken it in the past before 1964. Second most important thing is the interpretation of the rubric from the proving symptoms. Now I'll give you one example, but there is a very famous repertory where there is a rubric aversion to shampoo and fluoric acid is mentioned. Now aversion to shampoo means that you don't want to shampoo your scalp, correct? When I went to the original proving, it was mentioned that the prover was so lazy to take a shower. Do you follow? Now it gives a total different meaning, don't you feel? So now to give fluoric acid a marks in that rubric will be almost 0 to 1. I can't give more marks to that rubric. So like that, I won't say lie to you, but I have not verified the whole provings of all the drugs, because that's humanly impossible for 5,000 remedy. But for the polycrest remedy, I have checked a lot, whether exactly the proving symptoms were correctly made into a repertorial rubric or it is false. Like many times the prover says I have got pain in my legs, but in the repertory it comes as pain in the lower limbs. Do you follow? Yeah. So then I will give legs more important than lower limbs in my master score. Do you follow? Yeah. You understand? Then there are some clinical rubrics in the repertory. Like let's say in the Kent repertory there is a cancer of the bladder or cancer of the kidney, where there is a pteridine is a remedy. But in the literature, I have hardly found a case reported where cancer of the kidney or bladder has been cured by pteridine. So then that value of that rubric, Marco, becomes very poor, because there is no clinical confirmation next to it. So master score is not just logarithms, giving marks to the symptom, clicking on the icon and getting the remedy. There's a lot of hard work, lot of research based behind that to bring this wonderful result. You saw the case of gangrene. The doctors were totally flabbergasted when the woman's all the 4 figure became normal. So this can only be true if you have applied the right rubrics, the right remedy, the right search. So this is what I wanted to add.